In today's Focus on Family, helping your family grow, we're learning about National Fertility Week, which begins April 24th. Dr. Edward Marut and Penny Baxter are here from the Fertility Centers of Illinois. Thank you so much for coming in.
Thanks for having us.
I think there are a lot of things that people don't realize might impact their fertility. Women think age, perhaps, is the only thing, but that is a big factor.
Absolutely.
But not the only one.
Age is clearly the most important thing, and I think that as people decide to have children later in life, it actually impacts on them to have evaluation if they're not getting pregnant relatively quickly. If someone is not able to get pregnant within a year, that was a standard definition of infertility. Now if someone's in their mid-30s or later, they really should have an evaluation probably in half that time.
When we're talking about age, I think we often think about the female and the women and the age of the eggs and things, but really males are a factor as well in a lot of these cases.
Men used to get a pass when you had all the celebrities in their 80s having children, but the fact is when men hit their mid-30s, there starts to be a decline in sperm function. And even when they get into their 50s and 60s, there seem to be more increases in mutations of the sperm, so there are issues with fetal abnormalities. So men don't get a pass, they have to be evaluated, and just because someone's been fertile once, even a man, that they need to be reevaluated.
And then there are lifestyle issues. I know that women often think if they're underweight, they're good. But if you're too thin, it can be difficult getting pregnant. But if you're too heavy, it can as well.
It swings both ways. I mean, you know, to fight to get to a normal weight or an ideal weight is very difficult. But clearly there are limits where both being underweight and overweight can impact on ovulation, can impact on the ability to get pregnant. It also works in men. I mean, I don't think, again, about men who are overweight and men who are underweight. It has clear impact on hormones and semen quality. And the other lifestyle thing is probably first and foremost is smoking. I mean, smoking will damage the ovaries irreversibly. And there can be some recovery, but very often the damage is done, and that's something that also can age women's ovaries.
And I don't think women know about that. They think about stopping smoking when they get pregnant, but don't often think about while they're trying to get pregnant.
Yes, yes. And the other obvious things, alcohol, we talk about illicit drugs, but people also have to think about what about prescribed drugs. A lot of prescribed drugs are dangerous or will interfere, so women who are trying to get pregnant need to talk to their primary care doctor or their internist. Can I be taking these when I'm trying to get pregnant?
Some of this advice is so good, and it's sort of the education process that we're all going through right now, and I know you're having a lunch in this Fashion for Fertility that is helping educate people about what might be things that will help them get pregnant.
It is, and part of what we're doing with the luncheon, Fashion for Fertility, held at Four Seasons this weekend, let's see, April 23rd. It is an opportunity for some people to come forward and tell their stories about infertility, and I think that in itself helps a lot of women understand the journey of fertility and help them feel like they're not alone, that this happens to all kinds of women and all kinds of families everywhere.
And the money from the luncheon goes to Resolve, which is a national fertility organization.
It does, yes. All proceeds from the luncheon and from the silent auction will go to benefit Resolve and support their efforts.
And what does Resolve do exactly?
Resolve is an advocacy group that helps a lot, more times than not, lobby for certain laws and mandates for fertility patients. Like in Illinois, we are a mandated state.
So they get insurance coverage and things like that to help women out who are going through it. We have a number of items here that are going to be up for auction. If you are interested in going, I know there's still tickets available for the Fashion and Fertility event. That's Saturday. Dr. Edward Marut and Penny Baxter, thank you so much for being here from the Fertility Centers of Illinois. Fashion for Fertility, April 23rd, 11:30 at the Four Seasons Chicago. If you want to find out more information about the luncheon, you can go to fcionline.com, or if it's easier for you, we'll link you right there by going to WGNTV.com/midday. And again, you can watch some of the tips that Dr. Marut has to offer that will help all women with fertility issues.